OpenAI is moving fast, and this week made that impossible to ignore. They just launched ChatGPT Health, a dedicated health and wellness product where you can link medical records and wellness apps for personalized guidance. At the same time, they are openly training advanced systems to handle real office work end to end using actual workplace task data. And on top of that, GPT 5.2 just set a new reasoning record on ARCAGI 2. OpenAI is also now openly talking about something called capability overhang, the idea that these models are already more capable than how most humans know to use them. So let's break this down, starting with the biggest official launch, ChatGPT Health. This is not just ask health questions like before. OpenAI built health as a separate dedicated space inside ChatGPT. That matters because health is now being treated as a core product category, not a side feature, and the numbers explain why. OpenAI says that over 230 million people globally ask health and wellness questions on ChatGPT every single week. That's basically the size of a major social platform just asking health questions. So instead of leaving that scattered across random chats, they turned it into a focused experience. Here's what actually changes. Health lets you connect your real health data, and that's a big deal because health information is usually fragmented. One hospital portal, a PDF you downloaded once, Apple Health tracking steps and sleep, MyFitnessPal tracking nutrition, your wearable app doing its own thing, none of it talks to each other. ChatGPT Health is trying to become the place where all of that comes together. You can connect wellness apps like MyFitnessPal, and for medical records, OpenAI partnered with a company called Beol, which they describe as the largest secure network for connected US health data that allows health to pull records from certain US medical providers. Once that data is connected, you can ask higher level questions that actually require personal context. Things like interpreting lab results, understanding trends over time, preparing for doctor visits, or optimizing a wellness routine based on your own data. They even mention initial decisions like understanding trade-offs across plans using your healthcare usage as context. That's not generic chatbot advice, that's real decision support. OpenAI is also very clear about what health is and isn't. It's meant to help people take a more active role in understanding and managing their health. It's focused on everyday questions and long-term patterns, not diagnosing emergencies. And it's designed to support clinician collaboration and helping patients show up informed and prepared. Multiple write-ups frame this as OpenAI positioning itself as a serious global digital health player, especially in regions where digital health adoption is growing fast. Now, none of this works without trust, and OpenAI knows it. Health is built as a separate compartment inside ChatGPT with additional protections. They use purpose-built encryption and isolation, and they make a very explicit promise. Health conversations are not used to train OpenAI's foundation models. Health also has its own memory system, separate storage, separate connected apps, separate files. Health data does not mix with normal chats. Non-health context can help health if needed, like lifestyle changes or relocation, but health data does not flow back into regular ChatGPT conversations. Normal chats cannot access health files or memories. It's a one-way boundary. Users also have full control. You can view or delete health memories at any time, disconnect apps instantly, and remove medical record access whenever you want. They also support multi-factor authentication as another protection layer. App connections are fully opt-in. Even if an app already works with ChatGPT normally, connecting it to Health requires explicit permission. Apps in Health go through extra security view, collect only minimum necessary data, and users are clearly shown what data is shared. On the clinical side, OpenAI says they worked with more than 260 physicians across 60 countries over 2 years. Those physicians provided feedback more than 600,000 times across 3 focus areas. That's not a casual advisory group, that's a full evaluation pipeline. They even built something called Health Bench, a physician-informed assessment framework that evaluates responses based on clinical safety, clarity, escalation, and context. As for rollout, access is gradual. Early access starts with select users, expanding on web and iOS globally. Free Go, Plus, and Pro users are eligible, but early access excludes the EU, Switzerland, and the UK, likely due to regulation. Medical record integrations and some apps are US only for now. Apple Health requires iOS supported apps include Apple Health, MyFitnessPal, Weight Watchers, Alltrails, Instacart, and Peloton. You can also upload files like lab results and visit summaries directly. That's the health side. Now let's talk about the other thing. OpenAI is building, because this is where a lot of office jobs start to feel uncomfortable. OpenAI is developing an advanced system designed to handle nearly all daily office work and in many cases outperform humans. and they're training it on real office tasks, real instructions, and real deliverables. They partnered with Handshake AI to collect work data from contractors across multiple professions. They are collecting two core things: task requests and task deliverables. Task requests are the instructions you'd get from a manager, task deliverables are the finished outputs, Word documents, PDFs, PowerPoint decks, spreadsheets, images. And these are not tiny tasks, they specifically asked for complex work that takes hours or days. That's important because it signals training around long workflows. Starting a task, pausing, revising, fixing mistakes, organizing files, and delivering a final version. If this scales, you get something that looks less like a chatbot and more like a virtual office worker. There are protections in place. Contractors were required to remove proprietary and personal data. That's the line between training usefulness and a privacy nightmare. But the impact is clear. Administrative work gets hit first. Scheduling, coordination, data entry, junior content creation, and junior coding are already being compressed with one senior worker plus AI replacing entire teams. Customer support gets squeezed as AI systems learn real complaint handling and escalation patterns. Legal work gets affected on the junior end. Research, document review, drafting, finance and accounting to bookkeeping, audits, tax prep. Many firms already use AI at scale for this. The takeaway is simple: people who know how to use these systems become dramatically more productive. People who don't fall behind. Soft skills like judgment, leadership, and critical thinking become mandatory because AI still makes confident mistakes, and adaptability becomes non negotiable because the landscape keeps shifting every few months. Now, the third part is where the AGI conversation heats up again. GPT 5.2 just set a new record on Arc's AGI 2.0. That benchmark exists specifically to test abstract reasoning, not memorization. Every puzzle is treated as a new task. You can't brute force it with training data. Arc's AGI 2 was designed by Francois Chollet to expose the limits of pattern matching and test whether systems can infer new rules from minimal examples, the kind of reasoning humans associate with general intelligence. A system called Poetic built on GPT 5.2x high pushed performance to 75% accuracy on Arc AGI 2 while keeping costs under $8 per task. That's about 15 points above the previous best. For comparison, average human accuracy on Arc is around 60%. GPT 5.2 was already near that level. Poetic pushed it clearly above. The key point is how they did it. They didn't retrain the model for RK, they improved the system architecture around it, orchestration, step-by-step reasoning, knowing how to call the model effectively. So it's not just bigger models, it's smarter systems. The leaderboard also shows Gemini 3 Think Preview sitting around 46% behind the GPT 5.2 line while costing slightly more. And this is where OpenAI's own language matters. They're leaning hard into capability overhang. Models can already do far more than people are extracting from them. The bottleneck is no longer intelligence, it's workflows, integration, and human understanding. So here's the real question: what's more dangerous? ChatGPT knowing your medical history or ChatGPT knowing how to do your entire job? That one is going to split people. Thanks for watching. Catch you in the next one.